With the approval in the United States of Momelotinib for patients with myelofibrosis with anemia in September of 2023, trying to best quantify the clinical benefit as it relates to anemia has been of great importance. Also to really be able to help share with treating physicians what is that data so that they really are in the best position to utilize the drug most effectively for their patients. In the analysis that I presented at this year's ASH, we looked at a longitudinal analysis as it related to transfusion requirement for patients both from the SIMPLIFY-1 study. SIMPLIFY-1 study was the randomized JAK inhibitor-naïve phase 3 trial of Ruxolitinib versus Momelotinib, and then the Momentum study, second-line study. Patients were anemic, symptomatic, and had failed Ruxolitinib and were randomized to either Momelotinib or to Danazol. With these analyses, it clearly showed that patients had a clear anemia benefit related to both Ruxolitinib and to Danazol. And it actually showed both levels of anemia benefit. First, there's an anemia benefit that patients begin on a therapy and do not go from transfusion independent to transfusion dependent. And then second, if they come in transfusion dependent, do they have an improvement? So in this analysis, patients really are classified as either transfusion dependent or independent, and then the number of units. And really in almost a heat map like approach that we present with the abstract and in subsequent publications, we're able to see the kind of the full intensity in a heat map sort of way of the transfusion burden and the clear decrease in transfusion burden with being on Momelotinib, which is both, one, not developing transfusion need like the patients with Ruxolitinib, or two, an improvement in transfusion need. So again, another way of quantifying that benefit, that the anemia benefit of Momelotinib, again, are two different pieces. One, less drug emergent anemia that can occur with Ruxolitinib or at times fedratinib, and two, improvement in baseline anemia.